When you think about surgery, your mind probably jumps to the big dramatic parts, right? But what about what happens after? That's where suturing comes in, one of the most foundational skills in all of medicine. And let me tell you, it's way more than just sewing someone up. It's a mix of art and science that's absolutely critical for making sure a patient heals the right way. Okay, so take a look here. We're right in the middle of a periodontal procedure. And I mean, every single move is just so deliberate. Every stitch has to be perfect. In a situation this high stakes, how a surgeon closes that wound, that directly shapes the patient's entire recovery. It's really like this delicate dance between the needle, the thread, and living tissue. So if you remember just one thing from all of this, let it be this: no excessive tension. I'm not kidding. This is the number one, the absolute cardinal rule of suturing. You could have the slickest technique on the planet, but if you pull that thread too tight, you're actually doing more harm than good. All right, so here's what we've got on tap. First, we're going to break down that cardinal rule. Then, we'll get into the main types of sutures: interrupted, which are tied off one by one; continuous, for those longer incisions; and a really cool one called the suspensory suture. To wrap it all up, we'll touch on some advanced techniques for regenerative surgery. Okay, let's dive into that core idea: no tension. See, the whole point of a suture is to gently bring two edges of tissue together so they can heal. You're not trying to strangle them. Healing is all about blood flow, right? That's the foundation. And if you put too much tension on a stitch, you're basically choking off that essential supply line. And this is exactly why that rule is a non-negotiable. The big bad word here is tissue necrosis. That's just a fancy medical term for tissue death. What happens is a suture that's too tight squeezes all those tiny blood vessels, and the tissue it starves. No oxygen, no nutrients, the cells die, the wound can't heal, and eventually the suture itself just fails. So a gentle hand isn't just nice to have, it's a biological must. All right, first up on our toolbox, interrupted sutures. The name really does say it all. Each stitch is its own little island. You place it, you tie it, you cut it. It's totally independent from the stitch next to it. And the big advantage here? Security. If one knot somehow fails, no big deal. The rest of them are still holding strong. And it's not just one type. A surgeon's got a whole toolkit of these interrupted sutures to choose from. Think of each one as a specialized tool for a very specific job. You've got your basic direct loop, and then you have more complex stuff like mattress sutures, which are designed to spread out tension. Which one do you use? Well, that all depends on the tissue you're working with, where it is, and what you're trying to accomplish with the surgery. So let's break down the most basic one, the direct or loop suture. First, the needle goes through the outer surface of the first flap. It crosses the gap, and then, and this part is key, it goes into the inner surface of the opposite flap. Then it comes back to the starting side, and that's where you tie the knot. It's this very specific path that makes sure the edges of the tissue line up perfectly. And here's a perfect look at it. On the left, you can see that path the needle takes, going through the tissue. And on the right, that's the final result: a single, super secure knot holding everything right where it needs to be. Simple, right? But it's so effective. It's really the workhorse of surgery. But, a simple loop isn't always going to cut it, especially if the tissue is fragile. So building on that idea, we get to the horizontal mattress suture. This is what a surgeon uses when they need to grab a bigger area of tissue or spread the tension out so the stitch doesn't just rip right through. And you can see exactly how it works here. The needle goes in, then comes out on the same side, making a little horizontal stitch parallel to the cut. Then it does the same thing on the other side. When you tie it off, you can see it on the right, it makes this kind of box shape. It's kind of like a snowshoe for the stitch, spreading that tension out over a bigger area. And that's absolutely key for preventing damage. Then there's the vertical mattress suture. It's pretty much the same idea, spreading out tension, but instead of the bites of tissue being taken from side to side, they're taken vertically, so from top to bottom. Again, just another specialized tool in the kit for a very specific job. Okay, so interrupted sutures, awesome for security. But what if you have a really long incision, one that goes across a bunch of teeth? Can you imagine placing and tying like 10 or 15 separate knots? It would take forever and it'd be super bulky, so there's got to be a better way, right? And of course there is. That brings us to our next big category: continuous sutures. This is the go-to when you're closing up a long incision that covers several teeth. The whole idea is to use one single long piece of thread to secure the whole thing. And that's the magic right there. You only need one knot at the beginning and one knot at the end. That's it. So not only is it way faster, but it gives you this really even, almost zipper-like tension all along the incision. So how does it actually work? Well, just think of it like a running stitch in sewing. You tie a knot at one end, then the surgeon weaves the thread between the teeth, looping it around, passing it through the next gap, and on and on. You're basically weaving this thread, tooth by tooth, securing the flap all the way down the line until you tie it off at the very end. It's just a really elegant solution. Okay, so everything we've talked about so far is about bringing two pieces of tissue together. But what if you only worked on one side? What if you've got this one flap you need to secure, but there's nothing on the other side to attach it to? Well, that's where the suspensory suture comes in. I want you to picture a little hammock or a sling for the tissue. That's what this is. Instead of connecting two flaps, the thread literally just loops around the tooth itself. And that's what holds or suspends that single flap right where it needs to be without ever touching the other side. This makes it the absolute perfect choice for a really specific situation. Let's say the flap on the cheek side, we call that the buccal side, needs to sit at a different height than the flap on the tongue or lingual side. A normal suture just can't handle that. The sling suture, though, it's the perfect tool for that kind of custom job. Now, most of what we've covered is about closing things up. But suturing is also a huge player in more advanced stuff, like tissue regeneration. We're talking about procedures where the goal isn't just to close a wound, but to actually help the body regrow bone or gum tissue that's been lost. In those kinds of surgeries, surgeons often use this special little barrier, like a biological scaffold, to guide where the new tissue grows. And getting a perfect, totally tension-free seal over that barrier is everything. I mean, everything. Any little gap or bit of pressure and the whole thing could fail. So they use these advanced techniques like the modified internal mattress suture that are designed to pull the tissue together from underneath to create this perfect, stable seal that's so crucial for success. So, we've gone through all these different methods. What's the bottom line? Well, it's that there's no such thing as one best suture. The surgeon's choice is always a very calculated decision. It all comes down to the specifics of that particular surgery. What shape is the tissue, where is it, and what are we actually trying to achieve here? When you really think about it, it's this amazing blend of artistry, a little bit of engineering, and a whole lot of biology. And it really makes you wonder, doesn't it? What other simple things that we just take for granted are actually hiding this incredible world of complexity and skill just beneath the surface?
Today, we are diving into something that is, at the same time, incredibly simple and just mind-bogglingly complex. We're talking about the surgical suture. It's a piece of medical tech that's been around for thousands of years, but its modern form is an absolute marvel of precision engineering.
So let me ask you a question. When you think about what really makes a surgeon great, what comes to mind? Is it just having a photographic memory for anatomy, or maybe nerves of steel? Total, unshakable focus? Well, yeah, all of that is true for sure. But what if I told you that a huge piece of their genius
Actually comes down to something that feels, I don't know, almost ordinary? A skill they practice over and over and over again until it's pure muscle memory. It's that final, absolutely critical step in almost every single operation.
It's this, right here, the simple, elegant art of stitching human tissue back together. You see, a perfectly closed wound isn't just about ticking a box and finishing the job. No, it's about setting the stage for the body to do its own amazing work of healing itself perfectly.
Okay, so why is this one act so incredibly important? Let's zoom in a bit and look at the real goals of suturing and what it's actually doing on a biological level.
And really, it all boils down to this one idea. Wound closure is a key prerequisite for healing. Without that proper closure, every amazing thing the surgeon did before that moment could be compromised. It's the essential bridge between the surgery itself and the patient's recovery.
So let's break down exactly what a good suture job accomplishes. First, it maintains hemostasis, which is just a fancy way of saying it stops the bleeding. It also allows for healing by primary intention, meaning the edges of the wound are brought together so cleanly that you get minimal scarring. And on top of that, it reduces pain, holds tissues exactly where they need to be, and even protects the bone underneath from being exposed. It's doing a lot of work.
Now, to pull all that off, a surgeon needs the right tools. And believe me, this isn't your grandma's sewing kit. Every single component, the suture, the thread, the needle, is a highly specialized piece of equipment. Let's take a look inside the toolkit.
First up, the material itself. It basically falls into two major categories. You've got your resorbable sutures, which are incredible. They're designed to literally be broken down and absorbed by the body over time, so no need to come back and get stitches out. Then, on the other side, you have non-resorbable sutures. These are made of tough stuff like silk or nylon, and they're there to stay until a doctor removes them after the wound is healed.
Now, even the structure of the thread is a huge deal. A monofilament is basically a single, smooth strand, kind of like fishing line. It glides through tissue really easily, and its smooth surface means there are fewer nooks and crannies for bacteria to hide in. But then you have polyfilament, which is braided. This makes it a lot stronger and easier to handle, but that woven texture can, you guessed it, potentially harbor bacteria. It's a classic medical trade-off. Do you go for strength or for a lower infection risk?
Of course, the thread is only one half of this dynamic duo. You can have the most advanced suture material in the world, but without the right needle, it's pretty much useless.
And surgical needles are definitely not one size fits all. They come in this whole range of different curvatures. A relatively straight needle might be fine for surface-level skin, but a deeply curved one, like a half or even a 5/8 circle, lets a surgeon get into really tight spaces and take precise bites of tissue without having to twist their wrist into some impossible angle.
The needle itself has three key parts. There's the eye, where the thread goes, though a lot of modern needles are swaged, which means the thread is fused directly to the needle for a super smooth, seamless connection. Then you have the body, which is the main part that the needle holder grabs onto. And finally, you've got the point, which does all the real work. It can be tapered for delicate tissues or have a tiny cutting edge to get through tougher stuff.
All right, so we've got the tools. Now let's actually see how they're put into action with a real stitching technique. We're going to look at a really fundamental technique called the interrupted suture. The beauty of this one is that each stitch is completely independent. So if one of them were to somehow fail, the rest of the stitches are still there holding the wound closed. It's brilliant. Okay, so here we go. Step 1. The surgeon takes the first bite, passing the needle cleanly right through the outer surface of one side of the wound. That precision is everything. You don't want to tear the tissue. Next, the needle travels across that little gap and then passes through the other flap of tissue, but this time it comes up from the inside out. See that? This is the move that starts to bring those two edges of the wound together.
And just like that, with the suture passed all the way through, the tissue is perfectly lined up. Now all that's left is probably the single most critical part of this whole process, tying the knot.
And this, right here, brings us to the heart of the matter. All of that preparation, all that amazing technique, it all comes down to this one final manual skill. A poorly tied knot can completely undo an otherwise perfect surgery. So first, let's just quickly look at the anatomy of a surgical knot. It has three basic parts. You've got the loop, which is what actually holds the tissue together, the knot itself, which is the lock, and the ears, which are just the little trimmed ends. The goal is always the same. Make a knot that's small, super secure, and will absolutely not slip. So, how do you create that perfect lock? Well, the most fundamental knot is a square knot. It's such an elegant concept. You tie one throw in one direction, say clockwise, and then you follow it with a second throw in the opposite direction. It's that opposition that creates a flat, secure, non-slip knot.
Now, if you mess up and you tie both of those throws in the exact same direction, you get what's called a granny's knot. And while it might feel tight for a second, it's fundamentally unstable. It's prone to slipping under tension, which is the last thing you want in a healing wound. It's a total classic beginner's mistake.
But what if a surgeon needs a little extra security, especially if they're using a slippery kind of suture material? That's when they use a surgeon's knot. The very first throw is wrapped around twice. That double wrap adds a ton of friction, which helps stop that first loop from loosening up while you're getting the second locking throw into place.
And for situations that demand maximum security, there's a version where both the first throw and the second throw are double loops, tied in opposite directions. This creates an incredibly secure knot for areas under high tension, making sure that wound closure is rock solid.
So in the end, you can have a multi-million-dollar operating room, years and years of medical school, and hours of a super complex surgery, and it can all come down to the integrity of a perfectly tied knot. It's just a powerful reminder that in so many fields, true mastery isn't just about the big, grand gestures. It's about the flawless execution of the smallest details. So, what other tiny details can you think of that have an absolutely massive impact? You know, if you've ever had surgery, you're probably very familiar with stitches. That classic needle and thread has been the go-to for closing wounds for, well, centuries. But what if there are better ways, faster ways? What if we could heal without any stitches at all? Okay, let's get into it and explore the absolute cutting edge of surgical healing. So, are stitches just this thing we have to put up with? For the longest time, the answer was, yeah, pretty much. I mean, they work, right? But they also have their downsides. There's the discomfort, you have to go back to get them taken out, and there's even a risk of infection. All of this has really pushed innovators to ask a simple question. Can we do better?
All right, first things first. Before we can talk about the future, we have to understand the present. Let's talk about the current champion of closing wounds, the traditional suture. This is the gold standard that every new technology is trying to beat.
So, in many kinds of gum surgery, what's called periodontal surgery, a surgeon needs to get under the gums, to the bone. To do that, they create something called a mucoperiosteal flap. Once all the work is done, that flap has to be put back perfectly so it can heal. And for decades, stitches have been the tool for that job. And just so we're all on the same page here, what is a mucoperiosteal flap? Well, think of it as a carefully created section of your gum and the tissue connected to it. It's gently lifted away from the bone, giving the surgeon a clear view to work on the tooth root and the bone structure underneath.
Now, here's where you see the trade-off. On the one hand, sutures are great. They mechanically hold everything in place, which is exactly what you need for good healing. But on the other hand, well, you often have to go back for another appointment just to get them removed. They can be irritating, and some types, especially the braided ones, can act like a tiny rope, wicking bacteria down into the wound. Not ideal.
Okay, so if stitches have their drawbacks, what's the next step? This is where we start to see the first wave of real innovation, moving us beyond that classic needle and thread.
And that first step comes in the form of advanced periodontal dressings. Now, don't think of these like stitches that hold things together. Think of them more like a high-tech protective shield, a sophisticated bandage that protects the wound and keeps everything nice and stable during those first really critical days of healing.
This is where it gets really interesting. One of these advanced dressings is basically a tissue adhesive. It's based on something called cyanoacrylates. You might know its cousin, superglue. And as you can see, the whole approach is different. Instead of tying tissue together, it just seals the edges of the wound. You just apply it as a liquid or a spray, and best of all, no removal visit needed.
But we have to keep a balanced perspective here. As our source material points out, the idea of a medical-grade glue is amazing. But in practice, these have had, and I'm quoting here, varying success. So for now, their use is still pretty limited. It's a promising idea, for sure, but it's not quite ready to replace stitches everywhere just yet. Okay, so what if you could get the precision of a liquid but with the strength of a solid shield? Well, the next innovation on our list brings in a totally new element, light. This is pretty cool stuff. You've got products like Barricade, which starts as this soft, pliable gel. You can shape it perfectly to fit the wound, but it doesn't just dry on its own. It stays soft until the surgeon is ready. And then they use a special light to harden it on command, turning it into a rigid protective shield right there in your mouth. And the process itself is just brilliantly controlled. You apply the gel right from a syringe onto a dry wound, you shape it so it's a perfect, comfortable fit, and then, zap, a special light cures it instantly. It goes from a soft gel to a hard, smooth seal in just a few seconds.
So why is this a big deal for the patient? Well, first off, the final shield is clear and smooth, so it looks great, which is really important if the surgery is on your front teeth. And second, because you're applying a soft gel, you're not putting any pressure on that delicate healing tissue. It's just a gentler, more precise way to protect a wound.
Dressings and adhesives are a huge step forward, no doubt. But what about the ultimate goal? What if we could get rid of the need for stitches entirely by actually changing the surgery itself? This is the real game changer, flapless surgery. It's used a lot in dental implants, and the whole idea is to avoid making that big mucoperiosteal flap in the first place. And the logic is simple. If you don't lift a flap, you don't need any stitches to put it back. And the benefits here are just huge. We're talking shorter surgery times, way less pain and swelling for the patient afterwards, and of course, no stitches at all. It's a minimally invasive approach that can make the whole experience so much smoother.
So you might be asking, how on earth is this even possible? Well, it all starts with technology. The process begins with some serious high-tech imaging, like a 3D CT scan. This creates an incredibly detailed digital map of the patient's jawbone.
Then, using some very smart software, the surgeon can basically perform the entire surgery virtually. They can plan the perfect placement, the exact depth,
the precise angle of the implant, all on a computer before they ever touch the patient.
And here's the magic. That perfect digital plan is used to 3D print a custom surgical guide. This guide fits perfectly into the patient's mouth, and it has these little channels that guide the surgeon's tools exactly where they need to go. It translates that perfect digital plan into physical reality. It's incredible.
However, and this is a really important however, just like with the adhesives, the science tells us to be a little cautious. The source material is very clear that while this technology is amazing, using it as a routine procedure is still questioned. And the reason is simple. We just don't have enough long-term data on the outcomes yet.
So wow, we've gone from traditional thread to medical glues to light-cured shields and even to digitally guided surgery that doesn't need stitches at all. So what does this new toolkit for healing actually look like?
This table sums it up perfectly. Surgeons now have a whole range of options. You've got tissue adhesives for a fast, simple way to seal wound edges. You have light-curing dressings for a strong, good-looking shield in sensitive spots. And you have flapless surgery, which can dramatically cut down on the invasiveness and recovery time for things like implants. And all of this brings us to one final big question. As our technology gets more and more precise, with all these new adhesives and computer-guided techniques, could the surgeon's needle and thread one day become a thing of the past? You know, something you'd only see in a museum? It's a powerful thought, and it really suggests the future of healing is going to look very, very different from its past.